Dr. Kiran Bala, Sister Rupa, please take your seat. Dr. Ashok Mehta जी, हमें आज के इस सेशन में वैल्यूज़ इन हेल्थ केयर स्पिरिचुअल अप्रोचेस का उल्लेख उन्होंने अपने पहले के भाषणों में भी किया। उसका विस्तृत इंट्रोडक्शन कराएंगे कि विहासा है क्या और इसे कैसे ऑपरेट किया जा रहा है अब तक, और हम इसे कैसे अपने अपने क्षेत्र में इस्तेमाल कर पाएंगे। तो मैं आमंत्रित करती हूँ डॉक्टर अशोक मेहता जी को विहासा का इंट्रोडक्शन कराने के लिए। सर हमारे बीच आ रहे हैं, तब तक हम 2 मिनट परमात्मा की याद में साइलेंस में बैठेंगे। डॉक्टर सचिन, प्लीज़ आप भी मंच पर अपना स्थान ग्रहण करें।
Om Shanti. Om Shanti. I am going to make a presentation on values in healthcare, which is a personal and team development program for the healthcare professionals, doctors, nurses, and allied profession, dental, physiotherapists, etc. But this program is good for any hospital-based institution training. It's a phenomenal program. It's sad that I have to see so few people for this program. We are all familiar with our Hippocratic Oath, which was original oath written in Greeks between 5th and 3rd century. The principles of medical confidentiality and obligation not to inflict hurt, harm on others was the basic. No abortions, no poisoning, etc. And I think these were the values in those years for a medical profession, which was even when I graduated in 1955, we had to take Hippocratic Oath. I don't know whether current position, what is the situation. But this is this values in healthcare was created under the instructions of Dadi Janki. Many of you who may not be familiar with Dadi Janki, she was a former chief between 2007 and 2017 of Brahma Kumaris. But her major work was from 1974 till 2007 when she came to India. She was in London. And she was the first Brahma Kumari to travel overseas and establish the first center in UK. And today you know that the Brahma Kumaris are present in over 140 countries of the world. A tremendous work done by Dadi Janki. She was a diminutive person, 5 feet tall, but very active. She passed away at the age of 104. And it's interesting to know that she used to visit hospitals in UK, and what she noticed was something we have been hearing all the day. There was no happiness and joy she could see amongst the nurses and doctors and the workers in the hospitals in UK. And she was amazed that you are such a valuable persons working in healthcare professionals. Here we call them double doctors and next to God. And there the work was not appreciated, or maybe they didn't enjoy because they were under much of a stress. And she wanted to do something to bring the happiness and joy to the healthcare professionals. So she proposed to a group of Brahma Kumari associated healthcare professionals. You see a picture down there, who were all from different professions. There were general practitioners, there was a psychologist, psychiatrist, there were people in dental profession, physiotherapists, and the most important, there were educational consultants who agreed that we would do something for bringing values back to the work. And that's how the work started in the 2000. And what they did was that more than 1,000 hours, 10,000 hours of work on this program. Unfortunately, I didn't think we have the book lying there. As you can see, it's a huge book, 450 pages. Everything was reduced to writing. This program was created by this group and was, pilot studies were done in England to find out how effective they were. And they were very effective. This work was based on the work done earlier, values in education for the children, to bring values to children in New York City. This was done by one of the Americans who got a prize, and subsequently that book was published by the United Nations. This was a work which was based on what we call appreciative inquiry. So this is how, as a matter of fact, Dadi Janki was a nurse by profession, was aware of the morale and high burnout in the healthcare professionals. And this program was developed by Janki Foundation, a UK-based charity dedicated to positive human development. I think, and this was launched in this very auditorium by late President Dr. APJ Abdul Kalam in April 2006, as you can see here. And since then we have been at it. Initially we ran this program as we are also in a phase of learning, because this is a program which is slightly different than what we do normally. I'll show you how. This program is experiential program. In other words, and it is run in small groups. There is a person who is called facilitator who facilitates, but it is not lecturing. You don't lecture to people because you can't change values by lecturing. One of the things you must experience. Whatever experiences you have, you go back into it. So the first key principle was physician, heal thyself. We are such a valuable commodity, if I were to call it that way. You'd spend years and years in training yourself in becoming a doctor, and then practicing for maybe 30, 40, 50 years. And this is when we should give the best to our patients. We not only the physical care, not only the prescription and diagnosis, but holistic care. And this is what the whole program of mind-body medicine is all about. So physician, heal thyself. Healthcare professional is at the center of this program. Normally, the center of our program and attention is always a patient. But here there is a change. Instead of patient being at the center of health, it's a doctor himself who is at the center of healthcare. And it's basically a self-care of the healthcare professional to reduce their stress. We have been talking all these days, for the last 2 days, we've been listening about bringing happiness and joy and reducing stress. And restore the morale. What has happened is our morale has become low. We don't really, many of us feel that we are all threatened by medical legal actions by patients. Sometimes patients come and do a physical violence. Sometimes people are, threatened on the phone. I think this is what has brought down the morale. So the program is how do we feel good? How do we enjoy our work? And not only we survive, but we must thrive. We must enjoy our work. This is the whole purpose of this program. The key principle too is the learning through direct experience. We have, all of us, have a tremendous experience stored within ourselves, stored within our memory, stored within our soul. And this program is facilitated experiential learning. In this, there are people sit in a group, as you can see, about 20 to 25. There's one facilitator and one coordinator. And you work in pairs or in small groups of 4. But the important part is you spend more time with yourself. There is a time for reflection. Reflection is to go back into your own experiences and then sharing your personal experiences in a very supportive environment. In this program, we always tell people that first thing, that total positivity and appreciation, no criticism of any kind. And that is an important part. And confidentiality. Many of you share your very deep personal experiences, which is you have never shared with anybody earlier. But this is the program in which you have an opportunity of doing it. So this, as you see here, people sit in groups, and you work always with the next person who's your partner. And during the program, we have several exercises, maybe 8 to 10 exercises, and you change your partners. So you come to know each other very well. That's another thing. The third key principle is whatever you do there in this program is relevant to work and to your personal life. In other words, it's both important from your personal and professional life. We do what is called action planning, subsequently what you want to do, how you want to change your working. We also do the evaluation of the program and commitment to ongoing learning. This is not only one time, but you continue to do this forever. And what's important is you create a healing environment and high quality care by attending this program. This has to go back to your personal and professional life, which is very important. What the group did earlier, the group which developed this program, they wanted to find a solution to the issues facing healthcare professionals. So they broke up the themes into 4 areas. This was again based on the spiritual dimension of whole person medicine, what we are talking about, mind-body medicine, or holistic health, to be integrated in education and training of the healthcare professionals. We developed a flexible modular program for personal and team development. In other words, there are 8 values which we have addressed in this program. You can use any of the values to train. You may also use only a few exercises, not the entire thing. That's why it's modular. The key themes which have been covered are what are values, what is holistic health, what is positivity, and spirituality. Let's look at each one of these. Values are identified and applied, which are core values in the healthcare. We have the values which have to be carried out not only during but in all your activities, in thoughts, words, and your deeds. There are 3 types of values normally we talk of: human values, the moral values, and spiritual values. Human values distinguish a man from the beasts or man from animals. Barbarous infliction of pain and killing was the originality of human being. So you have that lying in your sanskars, in your soul. Then there are moral values which are higher, elevated, and a nobler human being you become. Certain values, we talk of morality. I think those moral values are very clear to all of us. We don't do certain things. It's immoral. We don't ask money from somebody behind, which we are not supposed to. We don't do any harm to anybody. So these higher, elevated, nobler human values we want to practice. And finally, be spiritual values which are necessary for spiritual growth, for self-realization and God-realization, about which you have been hearing for the last 2 days. So I won't go into the detail. And this all again, as I said, is based on Hippocratic Oath, which is our ethical health care. We have a source of values which are lying dormant within each one of us. We have to rediscover them, and we have, by giving too much of attention to our patients, giving too much from our own self, by compassion and by care, we have developed what we call compassion fatigue. We are going too far and our batteries are running down, and therefore it is necessary to recharge by connecting to the supreme source of all energies. I think in this program, for last 2 days, you have heard so much that we don't have to go into the detail of all this. And then we must remember the values which motivated and guided us at the start of our careers. All of us wanted to do the human service. We wanted to dedicate our lives to sick and those who needed your help. And we were all humanistic. At some point in time, as you climb the steps of your professional life, those early motivational forces or early principles which guided us to the medical school probably get lost. And we hear of so much of unethical practices when we talk about the hospitals and medical profession. In general press, people keep on writing ill things about doctors. So I think we must remember the principles and values at the beginning of our life, revitalize our practice by reflecting on them, and through a series of structured exercises, activities and meditation, these values will be taught or will be shared with the participants. Second principle is a holistic, a counterbalance to technological advances. Most of us who are consultants, super specialists and specialists, we spend entire working life only looking at the technical advices, reading journals, going for conferences and meetings. Most of you are consultants here, so I'm just telling you this is what I did, or for that matter, all of us do the same thing. In the bargain, we are all interested in what is the new thing that's coming up, new technology, new methodology, new drugs. So, holistic approach to living, pay attention not only to what we are doing as professional, but mind-body medicine in cultivating health and treat diseases. You have been hearing that most of our common diseases, chronic diseases, heart disease, coronary artery disease, diabetes, cancer, and so many other diseases are, even a process of aging is all related to our lifestyle, with the food that we eat, the stress under which we live, de-stressing that we do. So diet, exercise, meditation has been brought to you in detail even by Dr. Gupta this morning. And this is the theme of the entire holistic health, that you must take care of diet, vegetarian diet, and probably now people talk of low carbohydrate, high keto diets if you want to reduce weight. Otherwise, in carbohydrate diets, you put on a lot of weight. You have more diabetes, more coronary artery disease, more liver disease, and so on. And therefore, diet is very important. So is exercise. And you are experiencing every morning, 6:30, Sujata Ben is taking you through those interesting exercises. And we talked about those hormones, happiness hormones that we secrete with trying to do after the exercises. So it's very important, the diet, exercise, and of course the meditation, to quieten your mind, to make a positive approach to your life. I think meditation and spirituality has a tremendous role to play. So this is the same message is carried out in this program. you benefit of healthy healthcare professional to patient care is a prime consideration. Finally, it's a patient care through the doctor care that this program is going to work. The positivity is an appreciative inquiry to teaching and learning with no criticism of any kind is acceptable in this kind of program. And the entire exercises that you see everywhere, there's a principles of appreciative inquiry. This is used by educationists as well in educating the young children. A process building which works well in organization and individual practices. It's a structured questions to be appreciative, kept language positive. All the exercises have many questions, but their questioning is positive. Take a positive approach, adopt positivity to reflect in the material on the values in healthcare. The benefits of being positive. I can't understand.
5 वाजताना काही जण जाणार आहे बस. 5 बजे.
Okay. So benefits of being positive are physical, where you increase the energy, aids recovery from illness. The mental, which improves the self-esteem of the doctor and makes things easier. Social, with better relationship. And spiritual, increases the capacity to be hopeful. Valuing the self has a positive impact, not only yourself, on others around. Spirituality uses the inner powers of peace, love, positivity, compassion for healing the self and others, expressed through thoughts, feelings, attitudes, and memories and actions. There's an inseparable link between the mind and the body. I think all this has been told to you for the last 2 days, so we won't go into the details, but this is the principle. Belief in transcendental relationship between the self and the higher being or the Supreme Father has been. So we rejuvenate within us that which gives meaning and purpose to our lives. That is the spirituality. I think this is the diagram. I would like to spend a few minutes. You have understood the mind, intellect, and personality, sanskars. This is our inner being. It's the internal world of ours. Now, the soul is mind. Mind is the one which creates thoughts, emotions, feelings, and we create about 30 to 60,000 thoughts per day. And there's a massive numbers. Most of them are waste thoughts and negative thoughts. So all that we teach is a positive thinking, how to create the positive thoughts. And is intellect, which screens off the thoughts. This happens almost in milliseconds before you know it happened. And once you do some action again and again, it becomes a reflex. And then the intellect almost disappears and you do it, it becomes a personality trait. So it's very important to realize the control of mind and creating the positive thoughts. If I have to describe the Brahma Kumaris, I told you, Brahma Kumaris is nothing else but a school of positive thinking. And those 7 thoughts we are going to talk about. Now, intellect is one which screens off your thoughts. It's a judgmental. And personality traits are sanskars, which are right from the birth, from previous birth sanskars, and you develop during childhood. And by companionship. Now, whatever is your internal world, your expression in the outside world is through words and actions. And your emotions, desires, and decisions are all based on your internal thinking. So very important to take care of your internal world by creating positive thoughts and creating a beautiful sanskars. And whatever you do goes back, it's feedback and imprinted imprinted into your subconscious memory book. This morning, you have a beautiful class by Surya the importance of subconscious. So I think this is an important thing, how the inner world is useful for outer actions and worlds in the outer world. Values are not taught, but most of us, we pick up the values from the medical schools where we go. This is the medical school where I went, 1955 to 60, the GS Medical College in Mumbai, where we learned from our chiefs. They never taught us, but we learned by working with them. As a matter of fact, each one of us, when we enter our medical schools, have our ideals. Maybe some people have the parents, your grandmother, your mother, your teacher, somebody whom you take as a role model. So at that point, a role model, when I entered, to me was Mahatma Gandhi. I was a Gandhian, I used to wear khatar in those days. This was very early, just immediately after independence. And here is a picture of Parchure Shastri, a Sanskrit scholar who developed leprosy. And before he was turned away by his family, and he went to Wardha, to Sevagram ashram of Mahatma Gandhi, and there the watchman did not allow him to enter into the premises. But Gandhiji was told that somebody had come to see him, and he was lying outside under the tree. So he goes there, and he finds that this man, he was a Sanskrit scholar, but unfortunately he was suffering from advanced leprosy, and nobody wanted to keep him. So he was taken much against the wishes of the ashramites, was kept in the ashram, and Gandhiji himself used to dress him personally with his hands. In those days, leprosy was considered a contagious disease. And this is the picture that was subsequently displayed on a postal ticket, that leprosy is curable. This was 1958. But that's a very interesting, how, how compassionate was Mahatma Gandhi in his own life. Second role model for me was Dr. Albert Schweitzer. He won the prize, Nobel Prize 1952. Reverence to life was his theme. He was a white man who felt that he had to atone for the harm that the black men were done by the whites. So he decided to work in a Central African colony of Gabon. And this is where he shown his hospital was like a hut and taking care of the poor children. These two were my ideals when I entered the medical school, because this Nobel Prize was given in 1952. I'm sure that all of you have your role models, and you want to follow in their footsteps. So values are important principles of life that make life and work valuable, help understand the purpose of our life, and personal truths important for happiness. All of us are looking for happiness, so happiness comes through practice of values. Values are innate qualities of the soul. I think all of you have had a lot of classes on this, that 7 values, the knowledge, the most important thing, knowledge of self, the purity, which is the fundamental that we teach in this institution, and happiness and peace is a result of purity that we practice. And then we get love and bliss. And that leads to the power that we have. The power which is running down our batteries, that power we gain from the Supreme through practicing meditation. So we have the 8 modules. The entire values in healthcare has 8 values. First we had 7 values, and then subsequently we added the building resilience. And each of his module has a specific purpose. Values first is to gain strength through motivation. The peace we benefit by remaining calm and quiet. The positivity harness the power of thoughts. Compassion to increase your healing energy. Cooperation is appreciate the wisdom of teamwork. Dr. Sachin is here, he says beautifully in terms of the teamwork is very helpful. Valuing the self is sustaining the career, the carer. Spirituality healthcare is a spirituality care in practice. And building resilience is practical and positive response to stress and burnout. All of us go through certain times when we feel stressed out and burnout. That's the time we bounce back by using power of resilience. So each of this module takes a full day. It's 8 hours a day. So first the introduction of the module is done, and then there are exercises which will be shown later on. There are 7 spiritual tools we use for training. The first is meditation, quieten and focus the mind, direct the mind to a desired state of feeling, to be peaceful, calm, contented and happy, and more accepting and less angry. I think that's very important. Meditation is to focus and quieten the mind. The second is the reflection. In reflection, what we do is, whatever the best thing that we experience in our life is stored in our memory. We bring it back during the discussions. And we always think positive. We don't think of negative things that happen in life. Learn from past experiences, take a detached view. Actually, this is a very important thing. When you reflect, you are given a couple of minutes to reflect. And then your partner also reflects on the same point. And then you exchange your views. I think a very powerful tool. The third is visualization. Again, visualization you've been taught throughout the day about how you meditate. You visualize and create mental positive images using creativity and intuition, sights, sounds, smells, touch, all those 5 granularies, and how you felt peaceful. Whether it's the colors of a setting sun, or sound and a view of a flowing water, or a beauty that's seen in the nature. The other thing is a deep listening. We use deep listening. I think all of us as medical students have learned that you must take history taking, and history taking you allow the patient to say whatever he wants. But that's one way of creating confidence in the patient that you're taking care of. The other thing is appreciation. Whenever you have teamwork, you must appreciate all the members of the team. The smallest member of the team is also equally important. So, appreciation, we have a healthcare professional appreciation day on May 28th. I don't know whether all of you know this, but appreciation is a very positive tool, very strong tool. And the most important is the creativity and play that we do in this program. This is doctors are left cerebral, they are rational, logical and scientific. And right brain is the one which is creative, intuitive and poetic. So what we do is, when we play, working in groups, we can be creative. We create posters, we create skits, we create some kind of dramas. And this is very important. You sit down on the floor and talk to each other. Now this is where an institution is very important. If somebody is the head of department or chairman of the department or a dean or a superintendent, and he keeps away from the staff. Here we all sit together and we talk to each other as if we are on the same level. We are creating a beautiful atmosphere where you come to know the creativity of your staff. For example, when I was the director of one of the Brahma Kumaris hospitals in Mumbai, we used to work together on this program. And that's the time when I came to know my staff very intimately. Most of them were so talented. Some of them danced so well, somebody sang so well, somebody were very creative in creating posters and skits. So I think this is a very leveling ground, a very important program for administration. And during some of the exercises, we have a play where you create dramas or small skits, you dance, you sing, you have a music. So atmosphere is more of cheer and happiness. I think this is the essence of the whole program. And this is the group that you are seeing This was done in October 2014, where there are consultants, there are residents, there are nursing staff, there are even the clerical staff. This is important to recharge, continue giving. Self-care is a priority. Most of us, it's like our batteries of the mobile. At the right time, we find the battery is running down, and therefore it's important that we charge it every day. Similarly, with meditation, we should charge ourselves every day. Self-care is a priority and not a luxury. Only when we care for ourselves, we can care for others. That's a fundamental. And finally, I would like to quote this little poem by John Paul Moore. I've never made a fortune, and it's probably too late now, but I don't worry about that much. I'm happy anyhow. As I go along life's way, I'm reaping better than I sowed. I'm drinking from the saucer because my cup has overflowed. Our life should be same. It should be overflowing with joy, happiness. And this program is meant especially to bring this. This program has been in 35 countries of the world. This is where we went in 2006 to China. And there was another group come from America. Our program was highly appreciated by the Chinese Medical Association. And this program was also translated into Chinese. This is also available in French, Spanish, and so many languages of the world. So you are fortunate to have this kind of program available to healthcare professionals in our country. And I'm sure that many of you, I think many of you might have heard about this program. Some of them may not have, but there are many people we have now trained about 200 people as trainers or facilitators. In other words, there will be somebody in your area who will be facilitating. We have also converted this program into online program on a Zoom. But I think the Zoom program is still not final, very fine-tuned, but it's going on at the moment. The important thing is that the only downside of this program is that you require 8 days for training. In other words, you have to take out one full day for the program. You can do a half-day program. But you require also a good setup. You must have a very comfortable place. You're going to spend 8 hours together. So the place should be ideally air-conditioned. There should be facilities for dining or lunch and tea breaks. So you require, it is expensive to hire hotels, so you must have an ideal place built in a public institution. Like, for example, a program like this, a 3 days program, if you have to do in Mumbai, it will cost you anywhere between maybe 30 to 40 lakhs of rupees. I mean, it's an expensive way of conveying spirituality. So I think those of you who want to do this program should be able to provide that kind of a facility to enjoy this program. Thank you very much for giving me opportunity. Thank you.
Yeah. Thank you very much, Dr. Ashok Mehta. It was a wonderful introduction of VIHASA. Dr. Ashok Mehta has got a lot of experience with VIHASA, and that's why he was so much overwhelmed to express everything with you. So I request all of you to come closer because we are going to work in a group. Till today you were listening, but now you're going to speak. So this is an opportunity for you and us to work in a group. So I'll request all of you to come closer and sit in a group. In whichever part of the hall you are, just come closer because we are very few and we have to work in a group. So please come closer. Those who are sitting at the back, please come. Yeah. Yes, thank you. Okay. So Vihasa is all about working together in a small activities. So every time Vihasa, we have around 30-40 minutes with us, and we are going to give some glimpses of Vihasa. So Vihasa always, we start with icebreaker, so that everybody should speak. So we are going to have icebreaker for 3 minutes. So what is icebreaker? So I'll be showing you some pictures, and you have to identify the values in that pictures. So आपको इस पिक्चर को देखकर इसमें कौन सी वैल्यूज आपको नजर आ रही है उसे आइडेंटिफाई करना है. सभी को बोलना है. रश्मि खड़े रहेंगे और रश्मि write the values. Yeah, please. This group, this side. What are the values you see in the picture? Respect. Any other value from this group?
Hello.
Gratitude. Yes. Okay. Next, this group, middle group. कौन सी वैल्यू दिखाई दे रही है इसमें? Dedication. And any other value? Commitment. Yes. The third picture, the third group from that side, left side.
Here. Huh? Adjustment.
Adjustment. And
Hard
work.
Resilience.
ये शायद आप सभी में से किसी का पिक्चर होगा. आप सभी इस चीज को एक्सपीरियंस करते होंगे. तो लिख रहे हैं आप वैल्यूज. Okay. Any other value you identify with this picture?
Which picture? It is not sure. Achha,
Commitment. Okay. Very good. Now this picture.
Humor.
Working till death. But उसको हम कौन सी value का नाम देंगे? What value you identified? Dedication. Yes.
Selfless service.
Selfless
service.
Selfless service. Temperament. Loyalty. One value starts with alphabet C.
Courage.
Courage,
confidence.
Courage, confidence. Still, one value starts with C. Compassion, and one value starts with C.
Care.
Care. One value starts with C from this picture. Commitment. Yes, right. So कितनी सारी values एक picture में है? This picture. Compassion. Okay. Compassion.
Empathy.
Empathy. Okay. And what is this?
Support.
Support system. Yes, support. Supporting each other. This picture? Love. Joy. Happiness. Innocence. We all have that innocence within us, but we sometimes forget to enjoy that innocence. And this picture, last, joy. Togetherness. And teamwork. No ego. Yes. So, इतने थोड़े से पिक्चर्स में एक पिक्चर देखते हुए हमने उसमें से कितनी सारी वैल्यूज को आइडेंटिफाई किया. सो हमें ये जानना ज़रूरी है कि हमारे अंदर कौन सी वैल्यूज़ है. तो अभी मैं इनवाइट करती हूँ डॉक्टर किरण बाला और रूपा बहन को. वो हमें एक एक्सरसाइज कराए विहासा में से जिसका नाम है माय फेवरेट थिंग. सो डॉक्टर किरण बाला एंड रूपा बहन. सो आई विल बी हैंडलिंग दिस PPT. Okay, you can speak.
It's okay. So this is an exercise in which we'll see what are things favorite to me, because it's very obvious that we like things of our own choice. So let's see what are my values and how can we identify them. So I will tell you, you can. Thank you. You can read on the screen also. First is you have to think of songs you appreciate. We all have some favorite songs, and then just reflect that what values are reflected through words and music of that song. Just think about it, then we'll share. Next. This is the first thing. Then also think of the poems, the quotes, and books that are important to you. And try to find out what values are reflected in them. Just note down with you. The poems or quotes or any book which is important to you, which you like, which is very dear to your mind, and see what values are reflected in them. Third is that which images are important to you. Think of some favorite scenes, some views, some pictures, maybe some statue, and see which value or feeling is reflected in them. Just note down, then we'll share it. Give them. You have 5 minutes with you. So time is less, she's saying. So 2 minutes. So we can have more time for sharing. Are you ready?
Actually, we are doing this exercise with the pair, but now there is a shortage of time, so we are doing. Na? Ha. You can just do the pair. 5 minutes, we can take the 5 minutes for these 3 questions. Just share with your pair. Can just take pair. Rashmi, please, over here. Ha. Yeah. And just think about these 3 questions, what madam explained to you, your favorite song.
Shall I speak?
सबको क्लियर हुआ जो 3 क्वेश्चंस हमने पूछे थे डॉक्टर किरण बाला मैडम ने. फर्स्ट, आपका फेवरेट सॉन्ग ना, जब हम लोग बहुत खुशी में होते हैं तो ना चाहते हुए भी हमारे मुख से सॉन्ग निकलता है और पैर हमारे डांस करने लगते हैं जब बहुत खुशी में होते हैं. तो ऐसे वो सॉन्ग हो और उस सॉन्ग में से क्या वैल्यूज़ निकलती हैं, क्यों सारे सॉन्ग में से वो सॉन्ग आपको ज़्यादा पसंद आता है और उस सॉन्ग में क्या वैल्यूज़ रिफ्लेक्ट होती है, वो आपको लिखना है. सेकेंड, जैसे मैडम ने कहा था, सेकेंड क्वेश्चन जैसे थिंक ऑफ पोएम है, फिर कोई कोट्स है और एनी बुक जो भी आपने पढ़ी हुई है उसमें से अगर कुछ आपको याद आ रहा है, और हर बार जैसे प्रोग्राम का नाम है वैल्यूज़, तो हर बात हम वैल्यूज़ के साथ करेंगे। तो वैल्यूज़ क्या उसमें से निकलती है। एंड थर्ड इज़ अ इमेज और एनी नेचुरल सीन जो भी हम देखते हैं। जैसे फॉर एग्जांपल मुझे बीच पे जाकर सनसेट देखना बहुत अच्छा लगता है, तो उसमें से क्या वैल्यूज़ निकलती है। ऐसे ही कोई स्टैच्यू हम देखते हैं, उसमें से क्या वैल्यूज़ निकलती है जो आपको बहुत अच्छा लगता है। जस्ट शेयर विथ पेयर्स, पेयर्स में आप शेयर कीजिए एक दूसरे के साथ। मैम यू डोंट हैव एनी पेयर, कैन यू प्लीज। हाँ ठीक है।
Acha, okay. So, they are going to share the favorite song, I suppose.
Yes, ma'am. My favorite song is
Mic, please use the mic.
एक दिन बिक जाएगा माटी के मुंह,
All can sing with her.
जग में रह जाएंगे प्यारे तेरे बोल, दूजे के होठों को देकर अपने गीत, कोई निशानी छोड़ फिर दुनिया से बोल, एक दिन बिक जाएगा माटी के मोल. So this reflects humility in my thinking. And poem or book you asked, my favorite book is
Ma'am, values from the song.
Value,
Which values?
Humility.
humility.
Yeah.
So,
I did it very quickly actually, just one point came to me. I want to save your time. So I just noted one word. Book you have asked, it's my favorite is Bhagavad Gita, which reflects Rajyoga and Karma Yoga.
sorry, say it again. Values in Bhagavad Gita.
ma'am, Karma Yoga, Bhakti Yoga and Raj Yoga. Sorry. So
that everybody can hear.
Karma Yoga and Raj Yoga fascinate me, and I could understand Gita from the Brahma Kumaris only. Otherwise, I was unable to understand the Bhagavad Gita.
Good.
And my favorite statue is of Vivekananda, who shows confidence and belief in self. And in images, I visited Kashmir last year, and I was totally flabbergasted with the images of Gulmarg, and I found ultimate peace in the nature I witnessed.
So the
Peace.
scenes
Peace.
reflect peace.
Yes.
Thank you. Nice
you.
sharing. You would like to share?
I like a picture and a quote, like a person and saw 4 footsteps in his life path. Then after some time he could see only 2. Then he asked God, how if you are walking along the path of life with me whole the life, then how you could leave me in between. Then God answered, it was the time of your pain and sorrow. Then I lift you up, and those were mine.
So what value it reflected?
It was God with us every time, and He takes care.
What values? Care? Any other values?
Faith in God.
Faith in God.
Sorry?
Faith
in God.
Faith in God.
Care.
Caring, love.
Love.
So thank you very
Anyone
much.
wants to add in this? Any value you want to add in this?
Anybody else who would like to share?
Okay.
One more sharing.
Sir, please.
नहीं मैं बैठ के बोलती हूँ.
Please.
स्पिरिचुअल सॉन्ग मैडम.
Sorry?
स्पिरिचुअल सॉन्ग.
It's okay, no problem.
Yeah, it's fine.
ए मालिक तेरे बंदे हम,
Come in a front.
ऐसे हो हमारे करम, नेकी पर चले और बदी से डरे, ताकि हंसते हुए निकले दम. ये अंधेरा घना छा रहा, तेरा इंसान तेरा इंसान घबरा रहा, हो रहा बेखबर, कुछ न आता जर
What values?
Values from this song.
भगवान से जुड़ते, अपन भगवान से जुड़ते हैं मैडम.
Sorry?
कनेक्शन टू द गॉड
Connection with God.
आणि बिलीव ऑन गॉड.
Faith in God.
Faith in God.
Any other value?
When we go,
Gratitude. But she's saying.
pardon?
She's saying, you said gratitude? Yes.
Yeah, gratitude. And if you go outside somewhere and see a scenery, it feels very serene and calm. So that's the value when you see some scenery.
Sorry.
Okay.
Speak in mic.
When you go outside somewhere and see a scenery, like long back I had gone to Andaman Nicobar and
You are talking about natural
natural scenery.
Natural scenery.
Yeah, so when you see the nature, you feel very serene and calm.
Serene and calm.
Yeah.
Thank you.
Yeah.
Thank you very much. We can clap for them. Appreciation. Whenever somebody is sharing something, we must appreciate. So, the values, you have seen simple things, they are reflecting so much of values. That shows, as Madam has said, the song is dear to her, or the book which she likes, that reflects that you love that value. You have that value in you. That is why you have liking for that. So that is how we come to know our own values. An honest person will like to be in the company of an honest person. So this is how the values are reflected. Dr. Rupaben, you would like to add something?
Yes. From these two songs, we just find out this values, humility, then faith in God, confidence, then believe in self, confidence, peace, faith, care, love, connection from this gratitude for the God, and serene and calmness we got. So only these two songs we listen, these two songs only. From two songs we are getting this much values. So in this program, for each exercise we are getting so many values, so you can understand what values in with us. Okay, now we can come for the next exercise, that is a moment exercise. So I will call Sister Rashmi on stage for the moment exercise.
Thank you for sharing.
So, ये पहला एक्टिविटी हुआ फर्स्ट मॉड्यूल में. फर्स्ट एक्टिविटी यही है, माई फेवरेट थिंग. मुझे क्या पसंद है. जैसे हमें जो गाना पसंद है, बुक पसंद है, हमें जगह पसंद होती है, हमें कोई व्यक्ति पसंद होता है. क्यों पसंद होता है? क्योंकि उसमें हमारे जैसे वैल्यूज़ होते हैं. किसी किसी के साथ हमारी फ्रेंडशिप होती है क्योंकि हमारे जैसे वैल्यूज़ उनमें भी दिखाई देते हैं. तो जैसे हमने हर चीज़ में से वैल्यूज़ ढूंढने की कोशिश की, वैसे यहाँ से भी हम कौन सी वैल्यूज़ लेकर जा रहे हैं वो हम नेक्स्ट एक्सरसाइज में देखेंगे. लेकिन विहासा एक्टिविटीज़ का एक बहुत सुंदर पार्ट है प्लेफुलनेस, खेल खेल में सीखना. और अभी हम वो करने जा रहे हैं जिसको हम मूवमेंट एक्टिविटी कहते हैं, क्योंकि हम सारा दिन बैठे रहते हैं तो थोड़ी सी बॉडी की और माइंड की भी मूवमेंट होनी चाहिए. तो हमारे पास रश्मि बहन बहुत एक्सपर्ट है इसमें. वो थोड़े ही मूवमेंट्स में हमसे ऐसी एक्सरसाइज कराते हैं जिससे सारा मूड चेंज होता है. तो रश्मि बहन हमें एक्टिविटी कराएंगे. सभी खड़े हो जाए, अपने हाथ की सारी चीज़ें रख ले साइड में.
Na your feet. Stomp, stomp, stomp your feet. Swing, swing, swing your arms. Swing, swing, swing your arms. Dance everybody and sing with me. Dance everybody and sing with me. Na na na, I'm so happy. Oh so happy. Sing with me. Na na na, I'm so happy. Oh so happy. Sing with me. Jump, jump, jump around. Jump, jump, jump around. Touch the sky and touch the ground. Touch the sky and touch the ground. Shake, shake, shake your hips. Shake, shake, shake your hips. I know a song and it goes like this. I know a song and it goes like this. Na na na, I'm so happy. Oh so happy. Sing with me. Na na na, I'm so happy. Oh so happy. Sing with me. Clap, clap, clap your hands. Stomp, stomp, stomp your feet. Swing, swing, swing your arms. Dance everybody and sing with me. Jump, jump, jump around. Touch the sky and touch the ground. Shake, shake, shake your hips. I know a song and it goes like this. Na na na, I'm so happy. Oh so happy. Sing with me. Na na na, I'm so happy. Oh so happy. Sing with me. Na na na, I'm so happy. Oh so happy. Sing with me. Na na na, I'm so happy. Oh so happy. Sing with me.
और एक सॉन्ग, और एक सॉन्ग, हाथ पैर सब खुल गए, और एक सॉन्ग, यस, रश्मि, अभी अभी कर दो, अभी करें या एक एक्सरसाइज के बाद? अपने पास 15 मिनट्स है, अभी करना है? ओके। बहुत सुंदर। हाथ पैर की नसें खुल गई, ब्रेन माइंड फ्रेश हो गया, ब्लोन अप। ओके, अभी हमारे पास 10 मिनट है और हम एक एक्टिविटी फास्ट लेंगे। फिर से मैं आपको लिस्ट ऑफ वैल्यूज़ दिखा रही हूँ। हमने देखा कि जब हम वैल्यूज़ को आइडेंटिफाई कर रहे थे तब हमें नाम एग्जैक्टली नहीं चल रहे थे। हम कह रहे थे फेथ इन गॉड या ऐसे बिलीव। तो एग्जैक्टली वैल्यूज़ क्या होते हैं, फटाफट मैं पढ़ देती हूँ। एक्सेप्टेंस, बैलेंस, सेंटर्डनेस, कमिटमेंट, कोऑपरेशन, क्रिएटिविटी, डिग्निटी, फ्लेक्सिबिलिटी, generosity, honesty, humility, integrity, listening, loyalty, optimism, peace, practicality, respect, simplicity, trust, appreciation, benevolence, clarity, compassion, courage, dependability, enthusiasm, forgiveness, gratitude, hope, humor, kindness, love, openness, patience, positivity, reflection, responsibility, tolerance and wisdom. इतनी लंबी लिस्ट है वैल्यूज़ की। अब टेक अ डीप ब्रेथ, सिट कंफर्टेबली, टेक अ डीप ब्रेथ, इनहेल एंड एक्सेल। एंड इस लिस्ट में से इस एक्टिविटी का नाम है मेरे जो वैल्यूज़ मेरे लाइफ में मुझे जो इम्पोर्टेंट है, वैल्यूज़ दैट मैटर मोस्ट टू मी। मेरे लिए कौन सी वैल्यूज़ इम्पोर्टेंट है? तो इस पूरी लिस्ट में से आपको 5 वैल्यूज़ को सिलेक्ट करना है। सिलेक्ट 5 वैल्यूज़ दैट आर मोस्ट इम्पोर्टेंट टू यू। हाँ, दिखाई नहीं दे रहा है? इसीलिए मैंने थोड़ा पढ़ा कि आपको क्लैरिटी हो। So select 5 most important values to you. Okay? Selected? Okay. Now, out of those 5, select 3 most important values in your life. Out of 5, जो 5 आपने सिलेक्ट किए हैं उसमें से 3 आइडेंटिफाई कीजिए जो मोस्ट इम्पोर्टेंट है आपके पर्सनल एंड वर्किंग लाइफ में। ओके, नाउ इट इज द टाइम टू सिलेक्ट 1 इम्पोर्टेंट वैल्यू इन माय लाइफ। सो 3 में से एक वैल्यू चुनिए। जो 3 आपने इम्पोर्टेंट मार्क किए उसमें से एक वैल्यू चुनिए जो सबसे ज़्यादा इम्पॉर्टेंट है आपको अपनी लाइफ में, पर्सनल एंड प्रोफेशनल। ओके, सबने एक वैल्यू सिलेक्ट किया? ओके, हाथ खड़ा कीजिए जिन्होंने सिलेक्ट किया एक वैल्यू। ओके, आराम से बैठिए, गहरी सांस लीजिए, देखिए, चेक कीजिए क्या वो एक वैल्यू उन 5 या फिर सभी वैल्यूज से कनेक्टेड है। अगर वो एक वैल्यू हम जीवन में लाते हैं तो क्या सभी वैल्यूज़ धीरे धीरे हमारे लाइफ में आ सकती है? सोचिए, क्या जवाब है? क्या जवाब है? ओके, सो एक इम्पॉर्टेंट वैल्यू जो मेरे लाइफ में है। अब ये एक थोड़ा सा मेडिटेटिव रिफ्लेक्टिव एक्सरसाइज है। तो आप पैर नीचे रखेंगे, सभी क्रॉस लेग्स है, हाँ ओके, रिलैक्स करेंगे और एक बात सोचिए कि मैंने पास्ट में इस वैल्यू को अपनी लाइफ में, वेदर इट इज़ वर्किंग लाइफ और इट इज़ पर्सनल लाइफ, कब, कहाँ और कैसे यूज़ किया था, याद कीजिए। इस एक वैल्यू को मैंने अपने पास्ट लाइफ में कब, कहाँ, किसके साथ और कैसे यूज़ किया। ओके, नाउ कम इन द प्रेजेंट। आपने पास्ट में इस वैल्यू को जो यूज़ किया, आपको उसे याद करके कैसा महसूस हुआ? उस घटना को याद करके जब आप वैल्यूज़ को यूज़ कर रहे थे तो कैसा महसूस हुआ? अच्छा लगा? खुश हुए? प्लेजेंट फील हुआ? पीसफुल फील हुआ? ओके, नाउ कम इन द प्रेजेंट। प्रेजेंट में मैं इस वैल्यू को अपनी लाइफ में पिछले 4 दिन से कब, कहाँ और कैसे यूज़ कर चुकी हूँ? प्रेजेंट इन 4 days, रिमेंबर। ओके, अच्छा लग रहा है? ओके, नाउ गहरी सांस लीजिए। अब हमें इसे फ्यूचर में कब, कहाँ, कैसे और किन के साथ यूज़ करना है, उसका मेंटल प्लान हम अभी बनाएंगे। विजुलाइज करेंगे कि फ्यूचर में मैं इस वैल्यू को अपने पर्सनल और प्रोफेशनल लाइफ में कैसे इस्तेमाल करूंगी या करूंगा। ओके, माइंड ने आइडेंटिफाई किया, क्योंकि माइंड की स्पीड बहुत फास्ट है, तो हम माइंड से जो कुछ करते हैं उसको कम टाइम लगता है। ठीक है, सो हमने इमेजिन कर लिया, एंटिसिपेट कर लिया कि फ्यूचर में मैं अपने प्रोफेशनल लाइफ में, पर्सनल लाइफ में इस वैल्यू को कब, कहाँ, कैसे और किसके साथ यूज़ करने वाली हूँ। इसको ही मेडिटेशन भी कह सकते हैं या विजुअलाइजेशन कह सकते हैं। सो जो हमारे सर ने, डॉक्टर शुक मेहता ने हमें टूल्स बताए, स्पिरिचुअल टूल्स, उसमें एक टूल था मेडिटेशन और दूसरा था विजुअलाइजेशन। और कौन से टूल याद है आपको जो हमने सुने? स्पिरिचुअल टूल्स जो इतने अच्छे से सर ने एक्सप्लेन किए, कौन कौन से थे टूल्स? हाँ, रिफ्लेक्शन, हाँ, एक्सेप्टेंस था क्या टूल? अप्रिसिएशन, तीसरा विजुअलाइजेशन जो अभी हमने किया, चौथा टूल याद है? क्रिएटिविटी, लिसनिंग, अभी 2 बाकी है, प्लेफुलनेस और लास्ट अप्रिसिएशन। ओके, थोड़ा बहुत याद है, ठीक है, याद कीजिए, इतना अच्छा प्रेजेंटेशन आपने देखा। ओके, अब हमारे पास 2 मिनट है। ओके, तो मैं डॉक्टर सचिन परब को इनवाइट करती हूँ। उसके पहले मेडिटेशन तो हमारा हो गया, रिफ्लेक्टिव एक्सरसाइज। मैं अनाउंस करना चाहती हूँ कि आगे आने वाले समय में 2 प्रोग्राम्स है जिसमें आप पार्टिसिपेट कर सकते हैं। नेशनल लेवल विहासा ट्रेनिंग प्रोग्राम फॉर मेडिकल प्रोफेशनल्स 8 to 10 November 24, फ्राइडे टू संडे, ओम शांति रिट्रीट सेंटर, दिल्ली। वहाँ पर ये प्रोग्राम है, तो आप इसका लाभ ले सकते हैं। दूसरा प्रोग्राम है एनुअल विहासा फैसिलिटेटर्स ट्रेनिंग प्रोग्राम, जो इस प्रोग्राम को सीखना चाहते कि कैसे हम फैसिलिटेट करें अपनी अपनी जगह पर, तो उनके लिए 20 से 24 नवंबर 24 को ब्रह्मा कुमारीज मनमोहिनी वन कॉम्प्लेक्स आबू रोड में ये प्रोग्राम होगा। तो हम आप सभी से निवेदन करेंगे कि इस प्रोग्राम को पार्टिसिपेट करके लाभ लें। डॉक्टर सचिन अब कुछ अनाउंस करना चाहते हैं।
ओम शांति। कैसा लग रहा है आपको? हाँ हाँ, बहुत अच्छा। हमको कैसे पता चलेगा आपको अच्छा लग रहा है? अच्छा, मुझे आज तक समझ में नहीं आ रहा, इतना अच्छा प्रोग्राम है, पर सब जाने के बाद ये प्रोग्राम एजेंडा में होता है तो मुझे थोड़ा हर्ट होता है। हमारे प्रेसिडेंट इस प्रोग्राम को प्रमोट करते हैं, ही गॉट इट फ्रॉम लंदन। हमारे वाइस प्रेसिडेंट प्रताप मिदा हर जगह पे विहासा के बारे में बोलते। मैं जॉइंट सेक्रेटरी हूँ, मैं पूरे भारत में सभी मेडिकल कॉलेजेस में करता हूँ। इस प्रोग्राम की ग्रेट डिमांड है। ये साइंटिफिक प्रोग्राम है, ये केवल भाषण नहीं है, इसके ऊपर रिसर्च हुआ है। इट इज़ रनिंग इन 50 कंट्रीज ऑफ द वर्ल्ड। यहाँ पर भी देखो श्रीलंका से सिस्टर आई है, सिस्टर जस्ट स्टैंड फ्रॉम श्रीलंका। इन्होंने बुक खरीदी किया विहासा का, ये जाके वहाँ कंडक्ट करने वाले, इनके लिए तालियां तो बनती है कि नहीं? शी हैज़ कम विथ, कोई 1 लाख रुपया खर्चा करके केवल कॉन्फ्रेंस अटेंड करने को आया है और वहाँ पे जाके ये विहासा कंडक्ट करने वाली है ना। आई हैव मेट मैनी पीपल। अभी ये जोधपुर के एम्स के डायरेक्टर आए थे, वो चाहते हैं कि कुछ साइंटिफिक हो, तो हम ये समझते हैं कि ये प्रोग्राम साइंटिफिक है और इसके ऊपर स्टडीज हुई है। आप सोचो, दादी जानकी ने इसको लॉन्च किया डॉक्टर्स के लिए, तो आप में से कौन कौन है जो अपने एरिया में ये करवाना चाहेगा यहाँ से जाने के बाद? प्लीज़ रेज योर हैंड्स। सो प्लीज़ मीट अस, हमारी टीम है पूरी। मुझे ये प्रोग्राम इसलिए अच्छा लगता है कि इसमें भाषण नहीं है। सबसे बड़ी बात, लोगों की कैपेसिटी सुनने की ख़त्म हो चुकी है ना। लोग एक्टिविटी से जल्दी सीखते हैं। यस और नो? अभी लेक्चर या डांस, कौन सी बात आपको ज़्यादा एनर्जाइजिंग लगी? डांस अच्छा लगा ना, लेकिन फिर एक्टिविटी, फिर मेडिटेशन, एक्टिविटी मेडिटेशन, ये इसकी विशेषता है। यहाँ के बाद मैं गोवा मेडिकल कॉलेज में जा रहा हूँ। देखो, गोवा में मेडिकल कॉलेज के डीन ने बोला ये प्रोग्राम करो। कितने जगहों पे महाराष्ट्र में सर के गाइडेंस के अंडर वी आर डूइंग इट। इसको क्रेडिट अवर्स है महाराष्ट्र में। इफ मेडिकल काउंसिल कंडक्ट दिस प्रोग्राम, उसको क्रेडिट अवर्स मिलते हैं। सोचो, वाई एमएमसी गिव्स अ क्रेडिट अवर्स टू दिस प्रोग्राम? क्योंकि वो समझते ही ये प्रोग्राम इंपॉर्टेंट है। यस और नो? हमारे डायरेक्टर ऑफ मेडिकल एजुकेशन एंड रिसर्च श्रृंगारे सर ने उनको लेटर लिखा, उन्होंने कहा सब मेडिकल कॉलेजेस में करो। मैं जिस जगह पे जाता हूँ, बीइंग अ डॉक्टर, एडिक्शन तो है, मेरा बेसिक फील्ड एडिक्शन है जो बाबा ने निमित्त बनाया है, लेकिन वो कहते कुछ ऐसा बताओ जिससे कि सभी लोग तो नशा नहीं करते, उनके लिए क्या है? तो डॉक्टर्स के लिए विहासा प्रोग्राम है हमारा, पूरा स्ट्रक्चर्ड प्रोग्राम है। आप ये बुक देखो, और कल्पना बेन ने बहुत अच्छा कराया, रूपा बेन भी है, हमारे बहुत नर्सेस है, पूरे भारत में टीम है। इसमें एक प्रोफेसर बैठे, जरा खड़े हो जाओ, डॉक्टर तोलानी, प्रियल तोलानी। शी इज़ अ प्रोफेसर ऑफ फिजियोलॉजी फ्रॉम नागपुर। इनके लिए तालियां बजाओ। भारत में करंटली ये नंबर 1 जा रहा है, नागपुर जोन, जहाँ पे मैक्सिमम विहासा हो रहे हैं। मेरे को इन्होंने 2nd पोजीशन पे धक्का मार के डाल दिया। मैंने कहा मैं छोड़ने वाला नहीं हूँ, क्योंकि मुझे इसके रिजल्ट बहुत अच्छे। ये संस्कार परिवर्तन का प्रोग्राम है, अंडर अशोक मेहता गाइडेंस 17 साल से मैं कर रहा हूँ। सर ने हमको आगे रखा है। अभी देखो, शी इज़ HOD, प्रोफेसर HOD ऑफ न्यूरोलॉजी, रिटायर्ड। शी इज़ नॉट ऑर्डिनरी सोल, पर ये करवा रही है एट दिस एज। हमारी बहुत बड़ी टीम है भारत में जो विहासा करवा रही है। सो प्लीज़ थिंक अबाउट दिस प्रोग्राम। हमने थोड़ा लेट चालू किया, लेकिन अगला सेशन के लिए हमारे डॉक्टर बनारसी भाई आए हुए हैं। तो थैंक यू वेरी मच। हम यहाँ पे रुकेंगे, और आपको जो कोई इंटरेस्ट है ये प्रोग्राम कंडक्ट करना है तो आप प्लीज़ हमको मिलिए, हम बाहर में आपके लिए वेट कर। हाँ सर, कुछ बोलना चाहते हैं।
दिस इज़ अ प्रोग्राम विच the management of all institutions would like to have. People spend, for a program for a one day, if you call a management consultant, it costs you 50,000 to 100,000 per day. This is that kind of a program which exactly what the management guys do. Here you participate, there the guy comes and delivers. As a matter of fact, you all experienced the creativity in play. What Rashmi Ben did was amazing, isn't it? This is what a program has. You have all these 7 tools that we use, whether it's a meditation, reflection. You have a reflection also. You have a creativity in play, and the questions you asked, and this is how it goes about. So I think this is a very important program from the point of view of medical institutions, where we talk of stress and people committing suicides. This is the kind of a program which would bring out their problems and would reduce probably stress and unfortunate suicides which we are looking at. I think this is a management program of a very high order. Thank you.
मिनट साइलेंस में बैठेंगे. किसी को ये बुक चाहिए तो हमारे डॉक्टर कल्पना बहन और रूपा बहन ने बुक्स आपके लिए लाए हैं. इफ एनीवन इज इंटरेस्टेड. थैंक यू.
बांधो 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 हो बांधो बांधो भाई बांधो अपने द्वार सद्गुणों की बंधनवार सद्गुणों की बंधनवार ओ सद्गुण के सुंदर फूलों से होगा सद्गुण के सुंदर फूलों से होगा जीवन तुम्हारा खुशबूदार खुशबूदार